Hello, my dear friends, and welcome. It's so good to have you with us today for a conversation that touches upon something many of us experience, yet perhaps don't always discuss openly: the world of our dreams, and sometimes the unsettling realm of nightmares. We all know that a good night's sleep is one of the cornerstones of health and well-being, especially as we navigate our golden years. But what happens when our sleep is disturbed not just by aches and pains, or the need to get up during the night, but by vivid, frightening dreams that leave us feeling anxious, unsettled, and sometimes even a bit shaken when we wake up? Imagine Mrs. Peterson, a delightful lady in her mid-70s. She's always been a positive person, active in her local book club, enjoys her garden. But lately, she's found herself waking up in the middle of the night, heart pounding, with the lingering images of a distressing nightmare. She'd try to dismiss it. "Oh, it's just a silly dream," she'd tell herself. But the frequency of these unsettling nocturnal visitors started to increase. She noticed she was more tired during the day, a little more on edge, and sometimes she even felt a sense of dread about going to sleep. Mrs. Peterson's experience isn't unique. Many seniors find that their dream life can change, and sometimes nightmares can become more common or more intense after the age of 70. We might attribute it to stress, to something we ate, or just to the vagaries of aging. But what if these nightmares are more than just random brain activity? What if they are, in fact, subtle but important signals from our brain, trying to tell us something about its underlying health? Today we're going to explore the fascinating and increasingly important topic of nightmares in later life, what neuroscience is revealing about their connection to brain health, and why these unwelcome guests in our sleep might actually be an early warning system we shouldn't ignore. So let's gently pull back the curtain on the world of our sleeping minds. For a long time, nightmares were often relegated to the realm of psychology, seen primarily as reflections of stress, anxiety, or past trauma. While these factors certainly can play a significant role, recent scientific research is painting a much more complex picture, suggesting that recurrent bad dreams, especially in older adults, might indeed be knocking on the door as an early warning bell for underlying neurological changes. This isn't to cause alarm, but to empower us with knowledge. One particularly compelling piece of research that brought this connection into sharper focus was published in the journal eClinicalMedicine, part of the renowned Lancet family of journals. This study, and others like it, have begun to meticulously track the dream experiences of older adults over several years and correlate them with their cognitive health trajectories. What these studies are finding is quite significant. They've observed that older adults who experience frequent distressing dreams, say 1 or more nightmares per week, appear to have a notably higher risk of experiencing cognitive decline and, in some cases, a greater likelihood of later being diagnosed with dementia, including Alzheimer's disease. Let's try to understand what this means in practical terms. Researchers in these studies might gather data through questionnaires asking participants about the frequency and intensity of their bad dreams. They would also conduct regular cognitive assessments, testing memory, attention, language skills, and executive functions like planning and problem-solving. Over a period of several years, they would then analyze if there's a statistical link between how often someone reports having nightmares and how their cognitive scores change over time. For instance, the eClinicalMedicine study suggested that middle-aged individuals, 35 to 64 years, reporting frequent bad dreams had a higher chance of cognitive decline over the following decade. And importantly, older individuals, 79 years and older, who had weekly nightmares were found to be twice as likely to develop dementia compared to those who rarely had them. Other studies have pointed to similar trends, suggesting that an increase in nightmare frequency could precede the clinical diagnosis of certain types of dementia by several years, sometimes even a decade. This doesn't mean that every person who has a nightmare is destined for cognitive decline. Not at all. Occasional bad dreams are a normal part of human experience. However, a consistent pattern of frequent, distressing nightmares, especially if it's a new development or a significant increase in later life, is what these studies suggest we should pay attention to. It's as if the brain, in its subtle way, might be signaling that something is amiss, that some underlying processes are not functioning as smoothly as they should. This research is incredibly valuable because it opens up the possibility of identifying individuals at higher risk much earlier, potentially allowing for earlier interventions or lifestyle changes that could help protect brain health. It transforms nightmares from just bad dreams into potential biomarkers, subtle clues that warrant further attention and compassionate investigation. So if frequent nightmares can be a warning bell, what exactly might be happening in the brain to cause these distressing dreams, and how does it reflect on overall brain health? To understand this, we need to take a brief journey into the fascinating world of sleep stages and brain activity. Our sleep isn't just one continuous state. We cycle through different stages throughout the night. One of the most crucial stages for dreaming is REM sleep, which stands for rapid eye movement. During REM sleep, our brains are highly active, almost as active as when we are awake. Our eyes dart back and forth beneath our eyelids, our breathing and heart rate can become irregular, and most of our muscles are temporarily paralyzed, a protective mechanism called rematonia, which prevents us from acting out our dreams. This is the stage where our most vivid, narrative, and often emotional dreams occur, including nightmares. Nightmares themselves are essentially very intense, frightening dreams that often result in an abrupt awakening, leaving the dreamer with a clear memory of the dream content and a lingering feeling of fear or anxiety. From a neurobiological perspective, nightmares are thought to arise from a complex interplay of factors within the brain during REM sleep. One key aspect seems to be abnormal activity in certain brain regions. For example, the amygdala, an area of the brain heavily involved in processing emotions, especially fear, is highly active during REM sleep. In individuals prone to nightmares, the amygdala might be overactive, or its regulation by other brain regions, like the prefrontal cortex involved in reasoning and impulse control, might be less effective during REM. This could lead to an amplification of fear responses within the dream narrative. Furthermore, the balance of neurotransmitters, the chemical messengers in our brain, plays a critical role. Chemicals like norepinephrine, serotonin, and dopamine, which regulate mood, arousal, and stress responses, are all involved in sleep and dreaming. An imbalance in these neurotransmitters could contribute to the development of nightmares. For instance, some medications that affect these neurotransmitter systems are known to sometimes increase nightmare frequency. Conditions like depression or anxiety, which involve disruptions in these same chemical systems, are also often associated with more frequent nightmares. Now, how does this relate to broader brain health and conditions like dementia? Well, the very processes and brain regions involved in REM sleep and emotional regulation are also areas that can be affected by neurodegenerative diseases. For example, in the early stages of conditions like Alzheimer's disease or Parkinson's disease, there can be changes in brain structure and chemistry that might disrupt normal REM sleep function long before more obvious cognitive or motor symptoms appear. Pathological changes, such as the accumulation of abnormal proteins like amyloid or tau in Alzheimer's or alpha-synuclein in Parkinson's, might affect the brain circuits that control sleep and dreaming. This could manifest as more fragmented REM sleep, a breakdown in rematonia, leading to REM sleep behavior disorder, where people physically act out their dreams, or an increase in emotionally negative dream content, i.e., nightmares. So, in this context, the nightmares aren't causing the brain changes, but rather they might be a symptom, a visible manifestation of these deeper, underlying neurobiological disturbances. It's a sign that the finely tuned orchestra of our brain during sleep is hitting some discordant notes. While the link between nightmares and cognitive decline, particularly dementia, is gaining significant attention, it's also important to understand that our body and mind are deeply intertwined. Nightmares might not just be signaling issues within the brain's cognitive centers. They could also be an early indicator or a related symptom of other systemic health problems, reflecting a more comprehensive state of an individual's well-being. One striking example is the connection between nightmares and Parkinson's disease. Parkinson's disease is primarily known as a movement disorder, caused by the loss of dopamine-producing cells in the brain. However, we now know that Parkinson's also involves non-motor symptoms, and these can often appear many years, even decades, before the classic motor symptoms like tremor or stiffness become apparent. Among these early non-motor symptoms are sleep disturbances, and particularly REM sleep behavior disorder, RBD. As mentioned earlier, RBD is a condition where the normal muscle paralysis during REM sleep is lost, causing individuals to physically act out their dreams, which are often vivid, intense, and frequently frightening. Essentially, nightmares accompanied by physical activity. A significant percentage of individuals who develop RBD, especially later in life, go on to develop Parkinson's disease or other related neurodegenerative conditions called synucleinopathies, like Lewy body dementia. So in this context, distressing dreams or nightmares, especially if accompanied by dream-enacting behavior, can be a very early and important clue. Beyond neurodegenerative conditions, there's also emerging research suggesting potential links between nightmares and certain autoimmune diseases. Autoimmune diseases, like lupus, systemic lupus erythematosus, or rheumatoid arthritis, occur when the body's immune system mistakenly attacks its own tissues. These conditions are characterized by chronic inflammation, which can affect various organs, including the brain. Some studies and patient reports have indicated an increase in disturbing dreams or nightmares, preceding or during flare-ups of autoimmune diseases like lupus. While the exact mechanisms are still being investigated, it's hypothesized that inflammatory processes and changes in immune signaling molecules, cytokines, could cross the blood-brain barrier and influence brain function, including sleep regulation and dream content. Nightmares in this scenario might be a reflection of the brain's response to this systemic inflammation or immune dysregulation. Furthermore, poor sleep quality in general, which can be both a cause and a consequence of frequent nightmares, is linked to a host of other health issues common in seniors, such as cardiovascular problems, metabolic disorders like type 2 diabetes, and mood disorders like depression and anxiety. Nightmares can fragment sleep, lead to sleep deprivation, and increase stress and anxiety around bedtime, all of which can exacerbate these underlying conditions. For instance, the fear and physiological arousal experienced during a nightmare can cause a surge in heart rate and blood pressure, which, if happening repeatedly, might not be ideal for someone with pre-existing heart conditions. Therefore, it's becoming clearer that frequent, distressing nightmares in older adults shouldn't be viewed in isolation. They could be part of a larger tapestry of physical and mental health, acting as a comprehensive, albeit unsettling, early warning system that something in the body or mind requires attention. Given what we're learning about the potential significance of nightmares, especially after the age of 70, it becomes clear that dismissing them as just bad dreams is no longer a wise approach. If you or a loved one are experiencing frequent, distressing nightmares, it's a signal that warrants attention and proactive steps. Action truly is important, not to induce panic, but to empower you to seek understanding and support. The very first step is simply to acknowledge and pay attention. Start noticing the frequency and intensity of these nightmares. You might even consider keeping a simple sleep and dream diary for a couple of weeks. Note down when you go to bed, when you wake up, how you slept, and if you recall any dreams, particularly nightmares. What was the dream about, if you're comfortable noting it? How did it make you feel upon waking? This simple act of tracking can help you see if there's a pattern and provide valuable information if you decide to speak with a healthcare professional. Are they happening once a month or several times a week? Is this a new phenomenon, or has it been a long-standing issue that has recently worsened? Secondly, it's crucial to focus on overall sleep hygiene and brain health. Many factors can influence our dream life. Are you getting enough sleep overall? Is your sleep schedule consistent? Are you managing stress effectively? Is your bedroom environment conducive to restful sleep? Cool, dark, quiet? Are you avoiding heavy meals, caffeine, or alcohol too close to bedtime? Are you getting regular physical activity and exposure to natural daylight? Sometimes, improvements in these general sleep and lifestyle factors can help reduce nightmare frequency. Also, consider any medications you are taking. Some medications, including certain blood pressure drugs, antidepressants, or drugs for Parkinson's, can have nightmares as a side effect. If you suspect a medication might be contributing, don't stop taking it, but do discuss it with your doctor. They might be able to adjust the dosage or suggest an alternative. Thirdly, and this is very important, if you are experiencing a noticeable increase in frequent nightmares, especially if it's a new pattern after the age of 70, consider it a prompt to have a conversation with your doctor. Your doctor can help rule out or identify any underlying medical conditions that might be contributing, such as sleep apnea, which can cause fragmented sleep and vivid dreams, restless leg syndrome, or the conditions we've discussed like early signs of cognitive decline, Parkinson's, or even certain autoimmune issues. They might recommend a general health checkup, specific cognitive screening tests if appropriate, or a referral to a sleep specialist or a neurologist for a more detailed evaluation. Early detection of many conditions often leads to better management and outcomes. Finally, if nightmares are significantly impacting your sleep quality, your mood, or your daytime functioning, or if they are causing you considerable distress, please seek professional help. There are effective treatments available for chronic nightmares. Cognitive behavioral therapy for insomnia, CBTI, often includes components that can help with nightmares. There's also a specific therapy called imagery rehearsal therapy, IRT, which has shown good success in reducing nightmare frequency and distress. This therapy involves recalling the nightmare while awake, and then consciously rewriting the narrative to have a less frightening or even a positive outcome, and then rehearsing this new version. It helps to desensitize the dreamer to the fear and gain a sense of control. In some cases, medication might be considered, but this is usually after non-pharmacological approaches have been tried. Remember, you don't have to suffer through this alone. Help is available, and taking action is a sign of strength and self-care. So, my dear friends, as we bring our journey through the sometimes shadowy landscape of nightmares to a close, let's gather the key insights and carry forward a message of hope and proactive care. We've learned that nightmares, especially when they become frequent and distressing after the age of 70, are more than just fleeting figments of our imagination. They can be profound and often subtle signals from our brain and body, hinting at underlying changes or challenges to our health. We've discussed compelling research, like the findings published in eClinicalMedicine, which suggest a significant link between recurrent bad dreams in older adults and an increased risk of cognitive decline and dementia. We've delved into the potential neurobiological mechanisms, exploring how abnormalities in REM sleep, brain activity patterns, and neurotransmitter balance might contribute to these unsettling nocturnal experiences, and how these same mechanisms might reflect early stages of neurodegenerative processes. We also expanded our view to understand that nightmares can be intertwined with other health conditions, such as Parkinson's disease or even autoimmune disorders, acting as a broader early warning system. But perhaps the most crucial part of our conversation has been about action. The importance of not ignoring these signals. We've emphasized the value of paying attention to our dream life, practicing good sleep hygiene, and most importantly, speaking with a healthcare professional if frequent nightmares become a concern. Early screening, diagnosis, and intervention can make a significant difference in managing many health conditions, including those that might initially manifest through changes in our sleep and dreams. And we've highlighted that effective therapies exist for those troubled by chronic nightmares, offering pathways to more peaceful nights. The message today is not one of fear, but of empowerment and gentle vigilance. Our bodies and our brains have remarkable ways of communicating with us. Nightmares, in this context, can be seen as one such form of communication, perhaps an urgent whisper that encourages us to listen more closely, to seek understanding, and to take loving care of ourselves. I encourage you, dear friends, to be mindful of your sleep and your dreams. If you find yourself or a loved one struggling with frequent bad dreams, please don't dismiss it. See it as an opportunity to engage with your health in a proactive and compassionate way. Talk to your doctor, explore strategies for better sleep, and know that you are not alone. Our later years can and should be a time of vitality, joy, and peaceful rest. By understanding these subtle signals and responding with care, we can better navigate the journey of aging with wisdom and well-being. Thank you so much for joining me in this thoughtful exploration. May your nights be serene and your dreams be sweet.